I'm John Greene with the Infectious Disease Program at the Moffitt Cancer Center. So the RSV virus is a winter respiratory virus. We break down respiratory illnesses into upper respiratory, which are like the common cold. It gets a little bit of loss of voice, a cough, a sore throat, a sinus, but it's not really severe. Then it goes into what we call a lower respiratory tract infection, where you literally get pneumonia, you get short of breath, you get sometimes chest pain, you need to be in the hospital, sometimes the intensive care unit, you may even be on a ventilator. So once it moves from upper to lower, it can actually cause a lot of damage to your airways and even death. So we have two kinds. We have the Pfizer vaccine, we have the Glaxo vaccine. The CDC feels like both of them are similar. The first year of the vaccine, the first season that you use it, it'll give you about an 85+% protection against severe illness. The second year, without getting a booster or a revaccination, you will have some protection in the ranges of 50 to 60%. And so they don't know whether you should get this every year or every 2 years. We just are getting it rolling out now. You can get it with the flu vaccine, but the actual titer levels are lower, but we think they're not necessarily significantly lower to impair your ability to prevent the infection with the two vaccines at the same time. And then the other vaccines, whether it's COVID-19 or pneumococcus, nobody knows if you should get all three, all four of them all at once or space them out. And there's pros and cons to both, and that's why they decided to roll this out not as a requirement for everybody over 60, but they have this new designation called shared clinical decision making, which means you discuss it with your clinician, which is either a nurse, a pharmacist, a nurse practitioner, a doctor, physician assistant, and they discuss your personal risk factors, your desire to be vaccinated protection, your desire to prevent side effects and all this. And after the full discussion is made, you, the patient, decide with the help of the clinician whether you will get this vaccine or not. So I would say that people with cancer in general are at a higher risk of having a severe illness, especially in the world of the hematologic cancers, and especially at the age of over 60. And if they did get this vaccine, they would have a less chance of being hospitalized with a severe illness, just like they do for the flu vaccine and just like they do for the COVID-19 vaccine. So you should review these fairly similar. So it's felt to be quite safe, but some people will have pain in their arm, and because it's revving up their immune system, they'll have a low-grade temperature or a muscle ache, feel like they don't want to do much that day for the first 24 hours. The rare severe side effects that affect your neurologic system, such as Guillain-Barré syndrome, etc., those are extremely rare. They're true for any vaccine you take, and they're no more likely with this vaccine than they are with any other vaccine. However, the risk is not zero, but it's very minute. But that goes into the shared clinical decision making. So if you already have a neurologic disease and you can't really afford or desire a exacerbation of it, that would be a discussion with your clinician whether the benefit outweighs the risk, etc. But for most people, the benefit highly outweighs the risk for almost everybody that would qualify for this vaccine.